Note cards look great. There's 1, there's 2, 3, 4. Lucky number 5 in the back. Number 6.
From 1962 until 2000, the American obesity rate increased from 13% to 31%. Do you want to hear another heart-stopping fact? Over 300,000 deaths per year are contributed to obesity. There's tons of articles published every year about how to control obesity. Many of them include fad diets that limit calories, some limit fat, and others restrict certain types of foods like carbs. There's also magic diet pills that are marketed saying that they increase your energy, others that suppress the appetite, and some that restrict your body from absorbing certain things like fat with devastating side effects. There's always a new miracle cure posted every month in the magazines. Truth is, there is no miracle cure. It comes down to input versus output, the calories you take in and the calories you put out that are going to help control obesity. However, in previous years, doctors have started using surgery as a way to control obesity. In the 1990s, according to LapBand.com, Belgian doctors introduced the newest procedure for weight loss surgery, and that is the LapBand. What I'm going to discuss with you today is what the LapBand is, how it works, some of the pros and cons, and debunk a few of the myths that people have about weight loss surgery. So what is a LapBand? Lots of people have that question. This is a LapBand. It's a silicone-filled ring silicone ring that's filled with saline, and this is a hose that is connected to a port. This ring is inserted in on the top of the stomach, producing a little pouch on top. This cord runs down the body like this and is sewed to a port in the muscle of your stomach. And that port allows the doctors access to insert saline into this ring or take out saline depending on what's needed. How does the LapBand work? Well, of course, once you put it in your stomach, this is the whole stomach. When the LapBand is inserted, it creates a little pouch at the top of your stomach. So when you eat your food, it restricts how much food your stomach can hold at one time, thus decreasing the amount of calories that you can take in. This band gives a sense of fullness when this little pouch is full. Once the food is in the pouch, it digests, it goes through the hole into your regular stomach and through the regular digestion, just as if you did not have the band in. Why is the LapBand favored over other LapBand surgeries? Well, there's many reasons. The alternative to the LapBand is the gastric bypass, and it is a invasive surgery. The reason that people prefer the LapBand is because it's minimally invasive. It usually can be done through a laparoscopic process, which involves 6 small incisions that the doctors can insert microscopic tools and their other surgical tools into those small incisions. And of course that results in less trauma to your body, less recovery time, less scarring, and all in all just a quicker, safer surgery. Another thing that people like about the LapBand is it's the only weight loss surgery that's reversible. Once it's put into your body, and of course it's not meant to be taken out, but should a problem arise, it can be taken out of your body. Whereas with the gastric bypass, it involves cutting of actual organs that can't be reversed. Something else that's very good about the LapBand that a lot of younger people like is that you're still able to have children after you have the LapBand. A lot of times with the gastric bypass, your body cannot take in enough calories to support or sustain a normal pregnancy. But with the LapBand, the doctors can take out saline out of the tube to allow more calories to be ingested to support a pregnancy. And then once you've had the baby, they can put the saline solution back into the band so that you can go back to losing weight. I had the LapBand in March of 2008, and it's been very successful for me. The LapBand is a 3-year process. Most other surgeries have a 1-year success rate, meaning that doctors hope the patients will have lost 75% of their excess body weight within 1 year. The LapBand is a 3-year process, so it'll take me 3 years to reach my ideal weight. One of the reasons that doctors like this slower process is that many studies show, for example, one with Columbia University showed that the slower that a patient loses the weight, the more success they have of keeping that weight off in the long run, because your body adapts to that new lifestyle rather than just the quick process of dropping the weight. You have more ability, or it usually gets put back on. The one question that I get from everybody when I have this, or when I tell them that I had the surgery is, aren't you always hungry all the time? Because I've lost 92 pounds in that 12 months. And the answer is no. And the reason is, when they put this band in your stomach, everyone has a little bit of muscle right here at the top of their stomach that when you eat, your stomach starts to fill up. And when the food hits that muscle, it stimulates this muscle and sends a chemical to the brain that tells you you're full. Well, when you have the LapBand put in, that piece of muscle is right here, so it takes very little food to activate that muscle and tell your brain that you're full. So my body mentally is not hungry. Now physically, sometimes I'll have a gurgling in my stomach that tells me I'm hungry, but I don't have the mental need to eat anything. And so that really helps in keeping and sustaining the constant weight loss because I don't always feel hungry. Surgery for weight loss is not for everybody, but for some like me, it's just the tool I needed to start my new life.
1, number 2, there's 3, 4, 5, I'm still here, number 6.